Busch Chiropractic out of the Fort Wayne area. First off, good to see you. How are you?
I'm great, thanks. And yourself?
I'm doing well. I'm glad it's Friday.
By the way, it was a beautiful morning out there.
It is gorgeous.
I mean, it was fantastic.
Yeah, driving in from Fort Wayne, did you have to wear the shades early? Or
yes, I did, actually.
Sun rising and all of that?
It was beautiful, though.
It's gorgeous.
Oh,
It
yeah.
is really gorgeous. And it's about time.
I'm just hoping it gets warmer out there.
Do you have any control over that?
If I did, I would actually put in for like a 75, 80 degree day.
That's right. You guys are into adjustments, just adjust the weather
Exactly.
a little bit that way. Let's talk about, I guess, your roots. You grew up in the Fort Wayne area.
Yeah. Actually, I grew up in, I went to high school at Leo, Leo High School out north of Fort Wayne. I did some schooling at IPFW and then at Indiana University in Bloomington. And then after that, I went to Parker College of Chiropractic in Dallas.
What was your inspiration to become a chiropractor?
Well, my dad told me I had to be a chiropractor. He was a chiropractor. He retired back in 1982, and I after I decided I was going to be a lawyer, I found out later on that I didn't read that much and I didn't argue that well, and I was actually a lot better at helping people.
So you found the true profession.
I found the true profession that worked for me.
The right fit. You look at it when you first started to where it is now. A lot of changes in the business?
Oh, you know, the amazing thing about it is I think it's the way that healthcare is going right now. It's so much more accepted than it was even 20 years ago. And 20 years ago, we never had a problem, or at least I never had any problem working with the medical profession. But the amazing thing about the way that that healthcare is changing is people are starting to look for alternatives to the normal things that they've grown up with, and those are medications and operations. So they're looking for the alternatives to that stuff, and you know, I think the best thing that we can do is help people avoid pain pills. You know, all the problems that we have with those.
Sure.
And then, and then the idea that surgery is going to help fix everything, because it doesn't. And so what we're starting to see is that many people can actually help heal themselves or become healed without actually having to go through those procedures.
There are a lot of folks that can hang the chiropractic shingle on their office, so to speak. Congratulations. I know you're award-winning, nationally recognized as one of the best in this country. You do a speaking engagements? You have a book out?
Yeah, actually, I'm coming out with the second edition of my book. It's Surgery Not Included, which is freedom from health, or from, oh my God.
I'll let you back up.
Freedom from chronic neck and back pain, but it's surgery not included. And the second edition we're coming out with, we've got a couple of new chapters in it. They're going to deal with neuropathy, and that's another thing that we've been treating a lot lately. The amazing thing for me is, again, medication is pretty much the only thing that the medical profession actually has to deal with those things. And you see a lot of commercials for diabetic neuropathy and diabetic nerve pain. So what we're actually doing is we're actually helping people overcome those discomforts and those problems and actually get back to a normal lifestyle, either without the pain or with a great reduction in it. And so, you know, it's just amazing to me to be able to see so many changes in the people that we work with. You know, we're not just actually working with patients' pain; we're actually changing their lives in a lot of cases, and we're changing their relationships with their spouse or with their kids or with the people that they work with. And you know, it's fantastic to be able to help people change their outlook on life in general.
My situation was lower back pain, and there were two facets of pain involved. There was the lower back pain that necessitated surgery, so I thought was my only alternative. Then there was the pain when a $47,000 bill arrives, and that's a whole new pain.
That's amazing.
And I have other superlatives I could put ahead of that, but I'm not going to. But seriously, and you guys are all about trying to avoid that with, you know, prescription medications grabbing all the headlines right now, and the surgery aspect too. There's a topic I want to talk about that I've never really seen until I was doing some research on your office. The DRS protocol. What is that? Tell us about that.
DRS stands for decompression, reduction, and stabilization. And that's really what we're doing. We're decompressing a nerve or taking pressure off of it, reducing a disc bulge, and then stabilizing the whole thing so the problem doesn't return. And the idea behind it is, again, we've always known the body can heal itself if it's given the proper situation. We're just working to do that. The amazing thing about what we're doing, though, is we're helping a lot of patients that their only option was surgery, or half the patients I see have had at least one failed back surgery in the past. You know, when something that came out on April 14th, day before tax day, was the That was a painful. That was a painful day too.
That was a little bit lower that pain
exactly
on the next day.
But on April 14th, the New England Journal of Medicine came out and said that that most of the back surgeries and most of the spinal fusions are actually unnecessary, and they don't do any better job than any of the other types of surgeries that they were doing. Mm-hmm. And the other thing that's happened recently is that the number of spinal fusions is escalating dramatically. I think they did about 400,000 of them last year. The problem with that is once you have one of those, you're probably going to have another one again later on, because when they fuse one section of the spine together, it actually causes problems at the adjacent levels, just above and just below. And it really accelerates degeneration at those levels as well. So the problem there is that we have problems because of the scar tissue that happens as a result of the fusion. Mm-hmm. We have problems as a result of the fixation because of that hardware in there, and then the altered biomechanics as a result of everything else. So it's not, when people in the past have thought, well, if I just have surgery, everything is going to be better. It's not a final solution. It's actually the beginning into a lot of other problems. And we talked about this before. Surgeons do a great job with what they do. And trust me, there are plenty of things that need their treatment. I'm just trying to make sure that we can avoid people that don't necessarily need them. And there are a lot of patients that in the past thought that their only problem was surgery, or their only treatment was surgery. The patients that I see, they've seen a lot of other doctors. They've had epidural injections, they've had cortisone, they've had steroids, they've had physical therapy. They may have seen several other chiropractors. They've had, in a lot of cases, surgery. Mm-hmm. And the amazing thing that we've been able to do is help those people get back to a normal lifestyle, either without the pain or with a great reduction in it.
Is a majority of your patient load lower back problems?
Well, we deal with cervical neck problems, mm-hmm. cervical spine problems, lower back problems, sciatic pain.
Sure. That's what's
numbness and tingling in the arms and the hands. I saw a patient yesterday who actually lost pretty much control of his left arm as a result of a cervical disc problem. And we're going to do really well with him. The neuropathy patients that we deal with, where they have numbness and tingling in their arms or their hands or their feet as a result of things like diabetes, or some patients that have mechanical problems. There are a lot of other causes of neuropathy. We can talk about that on another situation. But the idea behind it is we're helping these patients without surgery, without drugs, and getting them back to a normal lifestyle and into their normal normal lifestyle. Yeah. And we see a lot of patients from this area as well.
And I think, I know you're looking at me saying, well, you're old. No wonder you're having problems small. But you treat all ages, really, don't you?
Yeah. The youngest patient we've treated with a disc problem was about 16, which is really young for a disc problem. She was a gymnast. Wow. And the oldest patient that we've treated was about 98 with a disc problem. Now, actually, we haven't seen her for about a month. But the oldest patient that I've treated in practice was 106, and she was neat.
I'd bank on 66 right now if I could have that. Somebody guarantee me that.
The funniest thing about it is every time she came to see me, she wanted a treatment, she wanted to tell me a dirty joke, and she wanted to give me a hug. So it was a lot of fun every time I saw her, and I always looked forward to it.
Always getting a squeeze from an older woman is always an excitement, too. But and is there any truth to the rumor, too? I mean, a lot of this preventative before an issue steps up to visit a chiropractor?
Well, there's no question about it.
Yeah.
It's kind of like preventative maintenance on your car. Do you get your oil changed?
I do.
Okay. My dad does every 100,000 miles, whether it needs it or not. Okay. But at the same time, he's always had car problems. Now, as far as the body is concerned, there's a lot. It's a lot easier to actually make sure that things are functioning properly, make sure that our immune system is functioning correctly, and make sure that we're avoiding those problems. And then the other thing about it is, and this is something that we talk about a lot with my patients, that once we get them feeling better, it's a lot easier to keep them feeling better than it is to get them feeling better again later on. And so it's a lot easier just to see them periodically to make sure that things are working properly. A lot of people talk about a chiropractic from the standpoint of, oh, well, if you go see a chiropractor, you're going to have to see him again for the rest of your life. Well, I don't look at it that way. I look at it more like once you know what it feels like to feel normal, you're going to want to feel normal all the time, right?
Sure.
And you're going to want to feel good all the time. And that's the whole idea behind that whole not only preventative health and preventative lifestyle, but also just a holistic approach to life.
I like the attitude. I do. I feel better talking to you already, too.
I really appreciate it.
It's like a mental adjustment I just got from Dr. Richard Busch. So accessible, too. Located in Fort Wayne. Thank God for the new 24, too. It is that much quicker. And
isn't that amazing?
Yeah, it is. I mean, I don't know how we survived. My wife is from Toledo. It's amazing we're still together after all those treacherous trips on the 2-lane highway going the other direction.
I drove to Detroit a couple of weeks ago, and the fortunate thing was I didn't feel like I was going to die the whole way.
That's right. I used to work the rosary beads in the one hand trying to drive in the other, and I couldn't text. That was the only problem with the whole thing. You're not too far from the mall in relative terms. You're going to find them. I'll tell you what, I'm going to make this very easy on you. I've already linked off the Mix Facebook page to their Facebook page, too. You'll find some great information there concerning Busch Chiropractic. They're at 5005 Riviera Drive in Fort Wayne. Telephone number is 260-471-4090. That's 260-471-4090. Again, it's all at your fingertips if you go to their Facebook page. Again, you can link right off the Mix page to that. You can meet a great guy with a great practice, with a great perspective on it that's going to save you a ton of money in the long run and make you feel better. You and family members as well. It is worth the call, worth the research to find out more about Busch Chiropractic. What a pleasure to have you.